Hello, everybody, and welcome to today's Hamline Leo lecture, Coping with COVID-19, Persevering Through a COVID Winter. My name is Molly Glevy from the Alumni Relations Office. I'm so pleased that we have lots of people joining us today for this event. And of course, our two speakers, Jody Metz, Hussein Rajput, who I will introduce in just a moment as they're joining us here. I am going to go through a few housekeeping things as we get started, and then we will be off to the races. So just a few things. Some of this will be familiar to some of you if you've joined us in the past, but you will be muted. Your camera will be off for today's presentation. And today's session is a little bit different than other Leo lectures we've done before, though if you joined us in June, we did have Hussein and Jody with us then. I think it was June. Time flies. I think it was June. So at that point, and we're doing the same thing today, we really set it up as a time to answer questions. And we've got lots of questions that people submitted in advance. And then we'll take your questions as we go throughout. If you want to submit a question, don't feel like you need to hold it back until there's a sort of a natural progression in the conversation. Just go ahead and put your questions in the Q&A icon in your Zoom dashboard. And I should say right up front, I can't imagine we're going to be able to cover all of the questions that we've received so far and that you'll have, but we are going to dive in and do our level best. If you have a question about the logistics of today's webinar, if something isn't working for you that you feel like we can help troubleshoot, use the chat icon in your Zoom dashboard. And we've got a few folks on who can try to help you if you run into anything. And then of course, the caveat that we all need these days, we're presenting from our homes, and you could see or hear kids, cats, dogs, snowblowers. I think that might happen. And of course, we persevere through our technology glitches at times too. So thanks in advance if we require your patience today. So with that, I'm going to introduce our speakers and then get us started. Jody Metz, physician assistant, PAC, MS, Director of Health Services at Hamline, and has been at Hamline since August of 2014. Her prior medical practice was at the University of Minnesota Physicians Mill City Clinic as a primary care and family medicine clinic in Minneapolis. Before becoming a physician assistant, she worked as a youth counselor, a phlebotomist, and in various roles for local nonprofits, and has also volunteered as a sexual assault advocate and as a disaster response volunteer. And Hussein Rajput, PhD, licensed psychologist, and our Director of Counseling Services at Hamline, joined our staff in December of 2005. Prior to coming to Hamline, trained in counseling centers at the University of Minnesota, the University of Oregon, the University of St. Thomas, and worked as a staff psychologist at Carleton College for over 6 years. Also has served as an adjunct psychology faculty member, teaching courses at St. Olaf, St. Mary's University, and the University of St. Thomas. So Hussein, Jody, anything you'd like to say as I stop sharing my screen and pull up the beginning, the start of our questions?
Well, just happy to be here again. I would say that probably in some ways a lot has changed since June, and in some ways, as we're all aware, not enough has changed with respect to our situation relative to COVID. And so I think it makes sense to be visiting again and talking some more about what we can be doing to persevere through this winter. Of course, my phone is ringing. Sorry.
I would just say the same thing. I was just thinking to myself a couple of days ago that I can't believe it's already been almost a year since all of our worlds have turned upside down. And while we've learned a lot, there's still a lot of unknowns. And so I'm happy to be here to answer any questions that anyone has.
All right, with that, like I said, throw your questions into our Q&A, and I am going to get started with some of the questions that people submitted in advance. And as you might guess, this will be pretty conversational and informal, and we will have a conversation and hope to provide all of us with some good information and reassurance moving forward. First up, In your point of view, how can the physical environment improve stress, anxiety, and promote perseverance?
Well, I'll go ahead and take a crack at that to start with. I think we're all thinking a lot about our physical environments in terms of our homes, apartments, residence hall, rooms, and so on. We're spending a lot more time indoors probably than ever before, and so I think that makes our awareness of our physical spaces, and in some cases the limitations of our physical spaces, that much more salient to all of us. I think that there are some things that we can do, certainly, and I would preface that by just acknowledging this is not primarily my area of expertise, but I think that there are things that we can do to sort of work with the physical environments that we find ourselves in. And it's probably in some ways, from a psychological standpoint, it's probably less important, kind of the specifics of what you do or how you decorate or arrange things, and maybe more that you find ways to make it work for you. So a functional space, a space in which you feel comfortable, a space in which you can minimize distractions. I think a big thing right now is trying to maintain some kind of boundary between a workspace and the space where we live the rest of our lives, which is really challenging, I think, for many of us. Unless you're in a 10,000 square foot mansion, there's probably going to be some overlap between those spaces. And I think that presents some challenges, not just in terms of logistics, but I think psychologically too. How do we separate from work? How do we get distance from work when it's the end of the day and presumably we're off the clock, but you keep on walking past that desk that has all your work materials, and you have this, constant visual reminder that, kind of work is still there. How do you maintain kind of a healthy boundary in that regard? I think is one of the challenges. And I also think that sometimes it relates to motivation to do work too. When you're at home and maybe you just as soon would be resting or relaxing, but it's time to get some work done. And how do you maintain focus in that regard? As psychologists, we focus a lot on this idea of stimulus control, that our environments control how we respond. So that harkens back to even kind of Pavlovian conditioning, for those of you who remember that from an intro psych class, perhaps, that our environments do have an impact on, how we function. And so sleep hygiene experts will suggest that you only use your bed for sleep, and don't, do work or homework or other activities that are potentially not conducive to rest and relaxation in that space. So that's a challenge now, where I think many of us are having to use our home environments for multiple purposes at the same time.
Yeah, I would echo what Hussein said. At the beginning of this, I actually, to a certain extent, despite all of the stressors, really appreciated the flexibility of being able to do certain work tasks outside of my normal 8 to 5, Monday through Friday schedule. But I really, really did have to learn how to create a routine and create a separation in between my work and my personal life, which was more difficult when you're at home, because it was very, very easy to check that email at 10 o'clock at night when I knew that it was there, or to just notice things that you wouldn't have otherwise noticed if you weren't at work. And it just, I had to separate more than I thought I would, my work life and my personal life, where at the very beginning of this, I was a little bit happy actually that I had this more flexibility. Like, I thought the previous 8 to 5 Monday through Friday life was a little rigid and to a certain extent. And so I really did have to make some adjustments that way.
Here's our next question. With your increased knowledge of COVID-19 and your observations over the last 9 months, how have you changed or modified your recommendations on how to cope with COVID-19? And I suppose that could be specific recommendations around being vulnerable to the disease itself, or items in mental health.
Yeah. So, I mean, when this all started about a year ago, there were so many unknowns. And to a certain extent, well, to a great extent, there still are many unknowns. And it's frustrating for a lot of us, I think, to not know what's going to happen. We used to say last spring, like, we don't have a crystal ball. We don't know what's going to happen. And while we've learned a lot more about the virus and how it behaves, the mitigation strategies and the behaviors that we're all so tired of are still what we need to do to continue to stay the course and just progress through the remainder of what we have left of this pandemic. So I don't know, I wouldn't say that I've modified my recommendations on how to cope with it, other than kind of like what we talked about in the last question, just finding a routine, making sure that you're taking care of your own well-being, and not overdoing yourself when it comes to work, when you're trying to separate your personal and work lives, and all the things that we have been doing. I haven't changed my recommendations a lot with regard to avoiding the virus itself, if that makes sense.
I don't know in terms of kind of the timeline exactly where some of these pieces fell into place, but I think a couple things from the standpoint of mental health that I think are factors in terms of coping is that because we do know more, that some of the uncertainty has been resolved, and some really important pieces related to that are we have a number of viable vaccines right now. So I think in the earliest stages in the lockdown, we as individuals, but also in terms of conversations in media sources and things like that, we were alternating between two poles. One of the extremes being, this is no big deal, or it's not even real, or it's just a slightly worse version of the flu. It may all be resolved in a matter of a few weeks. People are overreacting, so that was the kind of the minimization strategy. At the other end of the continuum, you had people saying, we're never going to be rid of this. It's going to be impossible to create a vaccine. Look at AIDS or other viruses where they've been present for decades, and we still don't have a vaccine available, and so on. Kind of the doom and gloom kind of approach. And I think, again, as both as individuals and as a culture, like we've fluctuated, and I think for many of us, we may have found ourselves on any given day at different places along that spectrum. I think one of the things that I have found helpful from a coping standpoint is this idea of both and thinking. I'm deriving this from some work by Pauline Boss. I actually read an article in one of my alumni magazines about some of her perspective on this, but this idea that the consequences of the pandemic have been both devastating and terrible for thousands, tens of thousands of people. And at the same time, this is a manageable situation, that there are things that can be done, both to keep us safe and, in the long run to, overcome this pandemic. So that's I think a trickier place to be psychologically, to kind of manage the complexity of that it's in some ways our impulse to kind of go to either end of the extreme, denial or, kind of worst case scenario. Those are simplification strategies, and sometimes it's easier to cope when you just have a simple, straightforward answer. Obviously, there isn't a simple, straightforward answer, but in the complexity of this, if we can kind of dwell in that place of both, and that it's both really hard and difficult, and there are some catastrophic consequences, and this is a manageable situation that we are going to get through. I think that's maybe easier to say that now, just with having resolved some of the uncertainty about certain key questions.
This next question sort of falls in line with that. Since seeing our responses in coping with COVID-19 over the last 9 months, would you say we're more resilient, less resilient, or in line with what you expected?
Hussein mentioned the two sides of the coin, and I was definitely at the beginning of this the doom and gloomer. I was the one who was like, "We're never going to have a vaccine," and so I would say that in my circles, lots of people are more resilient, but it just really depends on each person's individual situation, depending on where they're at. And just having some of these developments, having having the light at the end of the tunnel, if you will, with like the vaccine, makes me very hopeful. But it also, like my fear now is that people are going to see it as a golden ticket, that once they have that first dose, or once a certain contingent of the population has that first dose, then everyone's just going to break the doors open and go party at the bars and restaurants. So I'm a little worried about that. But the fact that we've had some of these answers to some of the questions that us doom and gloomers were thinking we wouldn't have answers to a year ago, I think that collectively we've learned to be a lot more resilient.
I would agree with that. And I guess I would also say that it's, that there just isn't a straightforward answer to that. I think about some of what I would call some of the deep structures of American culture that have been revealed through the course of this pandemic, in terms of the value we place on individual freedom, and also kind of the depth of the Protestant work ethic, if you'd like to call it that. And I think that there are, ways in which those closely cherished values and beliefs have had advantages, but also there have been downsides. I think we've struggled as a society, to balance, individual freedom and autonomy with kind of responsibility to the collective. I think we've struggled in certain ways with sometimes defaulting to, how do we just work harder, to get out of this. And I think, again, sort of on an individual level, as well as on a macro level, sometimes those strategies haven't always been successful. There's a great Einstein quote that kind of goes, I'm not going to get it exactly right, but the gist of it is you can't solve a problem with the level of consciousness that created it. And so one of our challenges is to be thinking or finding ways to be psychologically flexible and think about these things in some new and different ways. And to the extent that, at least for most of us, a pandemic of the scale is unprecedented within most of our lifetimes. This is requiring different kinds of thinking than what we've been used to. And so I think it's not exactly related to resilience directly, but I think that in some ways it pertains as well, as that some of what we're learning how to do right now related to resiliency is to not give up when our first round of coping strategies weren't very successful. And now we're finding, I think, more nuanced ways to cope. And I mean, arguably even the science, if you think about these mRNA vaccines, a novel technology in response to a novel virus, that reflects this kind of thinking outside the box, if you will. And so there are those sorts of silver lining kinds of, this is the paradox of this, is that it's both terrible and, we're discovering ways to be both individually and, kind of globally, as a species, more resilient than we were before.
Thank you. Do you have a comment or opinion about some of the new information that's coming out about the connections between things like vitamin D, sleep and sleep hygiene, blood type, etc., and the likelihood of having a severe case of COVID? Do you see reputable work being done here, or are we grasping at straws?
I definitely don't think we're grasping at straws. There's definitely reputable work being done along those lines. I would say at this point in time, most of that is going to be like observational type studies. So we're looking at just, this is a brand new virus that we don't know how it's going to behave. We don't know how it's going to change over time. And so the information that's out there is looking back on, who had COVID and why, and what were some of the parameters that we think might affect the severity of their illness. So I definitely don't think it's grasping at straws. I think it's, looking to learn as much as we can about the virus, so that we can approach treatment at a later date differently if we learn things about these types of things. So yeah, I definitely think there's reputable work being done. I personally have, if you're actually looking to look at those studies or look at the, the research that is being done, the observational studies, one of the best places to go still, and I recommended this back in June too, for reputable information, is going to be right here in Minnesota at the Centers for Infectious Disease Research and Policy at the U of M, which is directed by our own wonderful Michael Osterholm. So anybody can go onto that website and look at that research. There's really, really great summaries, and it's a reputable source. And you can even send Dr. Osterholm questions, and he will answer them on his weekly podcast if you're really interested into the nitty gritty nerdy stuff about that. But definitely, I think there's reputable work being done on that, and we're not necessarily grasping at straws. That being said, I don't want everyone to go out and buy, thousands of international units of vitamin D and shove it down their throats and think that it's going to prevent them from getting COVID and or treat COVID. But there is work being done in that realm that I think is interesting, if not hopeful.
And I guess I might chime in that some of those practices are potentially beneficial. I'm just thinking about sleep as one example. Getting enough sleep is a really good practice regardless. And I mean, the odds are, just statistically speaking, that the majority of the population, presuming a relatively timely rollout of vaccines in this new year, the majority of folks aren't going to get COVID with any luck. And so then it's really thinking about what are the things that will benefit you, whether or not you're exposed to the virus. And I think, in some ways we should also be thinking about, again, if you're working from home, if you have less access to some of the things that you would normally be doing to cope, what are just a good set of healthy practices to be maintaining right now, regardless.
Here's another one. Actually, this ties in as well. The question says, I imagine that I'm not the only one with less motivation and energy than usual. Do you have suggestions for setting personal goals while still accommodating lower morale?
So to the person who posed that question, I want to reassure you that you are not the only one. I think we're all there to varying degrees. And I guess I feel like there's sort of answers to this question on kind of two levels. And I'm going to start with kind of the sort of first level, and then I think that will lead into the second level. So in terms of goal setting, many of you are familiar with, I think, one of the more popular ways of conceptualizing goal setting. We do this with our performance reviews at Hamline, right? Is encourage employees to set SMART goals. Many of you are familiar with that acronym. So SMART, let me see if I can get it right, stands for specific, measurable, achievable, relevant, and time bound. If I've got that right, that's the gist of it, anyways. So goals that are specific enough, and that relates to being measurable, but that you can determine, did you actually meet that goal? Achievable, we don't want pie in the sky kinds of goals. Relevance, is it pertinent to the work of the organization? and time bound. So it's not like we'll get this done someday, but when, what is the deadline? And so the concreteness of that goal will lead to sort of accountability, right? So that's sort of a good set of heuristics for setting personal goals for yourself. The thing that I think, and this is the second level part of this, the thing that I think a lot of us are struggling with right now, this relates to motivation, is that relevance piece, that when you are operating in the context of a global pandemic, many of us, are grappling with these bigger existential questions. A pandemic brings to the forefront concerns about ourselves and our loved ones, about their safety, about their well-being, about their potential demise, which, I mean, that's a pretty harsh way to put it, but like that's the reality of it. We're scared, most of us, that there's a possibility that that we could die, or someone that we love has that potential to die. And I think for many people, unfortunately, as this pandemic goes on, that possibility has become a reality that many people know, depending on kind of your situation and your level of privilege and your level of access to healthcare, the degrees of separation between yourself and someone who maybe has experienced the death or loss of a family member or friend, those degrees of freedom decrease, over time. And so because we're grappling with some of these existential questions, I think the relevance of some of what we might have been doing day to day begins to be called into question. Does it really matter whether I get this seemingly insignificant task done in the context of a global pandemic? And that's where I think a lot of times motivation becomes a concern or an issue or a difficulty. And I guess I would argue that and this is back to this idea of like kind of our previous pre-pandemic consciousness and the Protestant work ethic, and many of us, myself included, are prone to these ideas of like, well, if there's a problem, just work harder and it'll be solved, right? The concern here is that maybe some of the things that we thought were relevant pre-pandemic are less important now. There's a reevaluation of our goals, of our priorities, of what really matters in life. And I would argue, as a therapist, that's actually really appropriate, that we should be reevaluating some of those things. And that one of the potential long-term consequences, positive consequences of this pandemic, is that we may not go back to things as they were before, and that some of the things that we change may be changes for the better. I think we've discovered that a daily commute where in an urban area, hundreds of thousands of people en masse, transport themselves from one location to another and fight with each other, jockeying for position on our highways and byways to get there, may not be, from not just from an ecological standpoint, but also from a mental health standpoint, may not be the best way to go. We've discovered that we can work from home in many cases for a number of jobs. There are things that, a reprioritization of some of our goals and some of our priorities. A number of people will talk about how their life has slowed down to a more manageable pace. And, these are trade-offs that most of us would not have picked, knowing the heavy cost in terms of human life. But there are these sort of paradoxical learnings, discoveries that we've made along the way. And I think that when it comes to motivation, when it comes to like, what are your goals or your priorities, this is in some ways a good time to be reevaluating that. And I'm not saying, that you should just sort of drop out and go off the grid. That's, that's a decision, to be made, kind of individually, but to use this time as an opportunity while much of our sort of normal, quote unquote, routine is on pause. There is kind of a moment potentially to reflect on, are the ways that we were habitually doing things as a culture and as individuals, are those things that we should just default back to? Should we just go, glad that's over and just go back to that wholesale, or should we be a bit more discerning and consider what we might want to even retain from these changes that we've had to make. So that's a very meta response to the question, but I hope it's helpful.
Here's one that's a little different than what we've been talking about. I am an avid reader. It is an enjoyable activity I use to unwind. But in this last year, between the pandemic and current events in the US, I've had a hard time picking up a book and focusing. Any advice?
I don't know if
So
I have any advice, but I commiserate. The same. I'm also a voracious reader, and I've had a hard time justifying reading things for fun when I have so many things to read for COVID or for work or for, like nonfiction versus fiction or just fun, frivolous things. I feel kind of guilty sometimes. So I'll let Hussein tell us what we should both do.
Well, I will also commiserate. I mean, I think it begs some questions, like in your case, Jody, like, are we allowed to still have fun, during this time? And I think that depending on your circumstances and what's happening to you and the people around you, there might be legitimate reasons why you might say this is not a time, it would be disrespectful, to other people and what they're going through for me to be, enjoying myself or having fun. But I guess I would caution, that we shouldn't take that to an extreme, especially when we're talking about a period, of many, many months. It's not sustainable to say, okay, well, I swear off, doing anything that's pleasurable or enjoyable because there's suffering in the world. So we I think, could kind of unpack that further. That's a conversation for another time, perhaps. But I would also say that when noticing yourself being distracted, whatever the task is, whether it's trying to read for pleasure or whether it's trying to get a work task done or things like that, I think this is where some mindfulness can come in handy to just notice what is going through your mind when you're trying to do that other task that's interfering, and maybe make some space for those thoughts. Are there particular worries that you're having? I think that trying to multitask your way through doesn't always work, and that sometimes pausing and saying, okay, what's going on here? What's distracting me right now? Am I worried about something else that I could be addressing directly, rather than trying to do sort of two things half-assed? Maybe I'll just do, the one thing that's sort of nagging at me right now, and figure out what that's about. It also, I think, relates to the question of motivation. I don't think that there's necessarily, if you're awake and conscious, I don't think there's necessarily such a thing as having no motivation. I think sometimes it's just that we don't feel motivated to do the thing that we feel like we ought to be doing at a given time. And sometimes it's worth paying attention to that as well. Maybe what I'm really motivated to do right now is to take a nap because I've been sleeping so poorly, because I've been worrying about COVID related stuff at night. And I think depending on kind of the situation and the context, maybe that's what one needs to do. If you have that flexibility in your work schedule, and have that ability and the approval of your supervisor and so on, maybe that's something to just go with, rather than trying to force yourself to do the thing that you feel like you ought to be doing or ought to be enjoying even.
I have the same problem lately. I can commiserate as well. Do you see an increase in the physical manifestations or symptoms of anxiety, stress, and depression? And what advice do you have for those who might be trying to distinguish between those symptoms? But maybe it's COVID, is the way the question is written. I'll let
That
you
was
have it.
actually a real struggle at the beginning, especially when you didn't have access to tests. So now, if you think it's COVID, you should go get a test. So because the availability of testing is widely there now, and it is very true that a lot of the physical manifestations of depression, anxiety, and stress are very similar to what happens in COVID and all kinds of other upper respiratory and other infectious diseases. We know that when you're stressed and anxious, you're more vulnerable to those mental health issues, as well as to get more sick, from physical issues. So if you think you have COVID, go get a test. And if you think if you do have depression and anxiety and feel like your symptoms might be exacerbated by the current situation, then certainly reach out for help among your friends and family and any professionals that you have access to as well.
And I would just add to that, it's not mutually exclusive, that people can be dealing with some mental health concerns and potentially contract COVID at the same time. And so again, that comes back to, to get tested, that you can at least have definitive information about that, and which will guide, the direction that you go. If you've waited the appropriate amount of time, or if you've gotten tested, in the right interval, and you can rule that out, then that points you in a different direction in terms of what you might do to cope.
Should people still prioritize working from home if they're able to do so?
Jody, I know you
Yes.
have a strong opinion about that.
I have very strong opinions about this. Yes, I think that especially right now, with the the likelihood of a post-holiday surge upon us, in addition to these new variants that are emerging, globally, we're kind of now at the beginning of it in the United States. But if we look at what's happening in Europe and Brazil and South Africa, we know that there's a very strong likelihood in the next 6 to 8 weeks that there's going to be some pretty big numbers here again, if we've been paying attention to history. And so, yes, I really do think that if you are able to work from home, you should be working from home. And that's not just to protect you, that's to protect the people that can't work from home. So, just minimizing the public health mantra, or, the public health risks that we've been talking about for a year now. Staying as far away from people as you can, like not spending time in indoor environments for any long period of time, wearing a mask, washing your hands, all of those things are still really, really important. And if you have the ability to work from home, I think that we really should be prioritizing that right now. I see a disconnect, not just in Minnesota, but everywhere. But, like the numbers are down. Why can't we go to the restaurant? And I'm like, the numbers are down because we aren't going to the restaurants. So as soon as we start to open things back up again, those numbers are going to go up, and everybody has to sort of decide what their risk tolerance is. And I think that employers are kind of learning this curve as well, that just because the numbers are down right now doesn't mean that we can just open everything back up or make everybody come back to work and get back to normal. I want to get back to normal too. Like I'm really, really happy that we are able to see our student patients virtually. We've given access to some students that weren't able to get to us, but the visuals, the video with the actual medical practice is fatiguing, and I cannot wait to get back into the office. But right now, I just don't think it's like wanting it isn't going to make it happen. I think it's very, very important that if you're able to work from home, you still should continue to do so. So yes, I do have a strong opinion on that one.
And Jody, maybe you can speak to this as well, but my understanding is that in terms of the effectiveness of the vaccines, that them having to do less work is going to benefit everyone from a public health standpoint if the numbers are lower at the time that vaccines are being distributed. Is that correct?
Correct. It's kind of like it was at the beginning. We want to flatten the curve, slow things down so that we don't overwhelm the healthcare system at large. So yes, it would definitely help. I mean, that's part of the problem with the vaccine distribution right now, is that the people who are trained and have the logistic capacity to be able to give vaccines are busy taking care of the people with COVID. So it's hard to roll out an unprecedented, vaccine dissemination while also dealing with the worst pandemic in our lifetime. So I really, really do strongly support everybody, working from home as much as possible, and allowing that space for the people who can't work from home. You're protecting not only yourself and the community, but also the people that, a grocery store clerk can't work from home, or a police officer, or public safety officer. So, you're protecting the community as a whole. It kind of goes back to what Hussein was saying earlier regarding like the individual versus the community. So yeah, I really do support working remotely whenever possible.
Here's one. This is a good question too. How safe is in-person routine preventative medical care at this stage of the pandemic?
It really, there's a whole bunch of factors there. So in general, it's pretty safe. Like most, we do know that people have been delaying their routine preventive care, and even not even preventive care, even care that's needed. Like people are dying of not only COVID in their homes, but things like heart attacks because they're afraid to go to the hospital and get COVID. So most primary care clinics that I'm familiar with are really doing a great job at separating, potential infectious, like respiratory patients, for example, or COVID testing, into different spaces, depending on what they have available to them. So if you're going in for your colonoscopy, for example, I would say that that's relatively safe. They have protocols, and we don't want anybody to not do what they would normally do or what they need to do because they're afraid of getting COVID in the office, if that makes sense. Everybody's doing a pretty good job of creating protocols to keep people as low risk as possible. That gets to be much more difficult now that we know that there's significant community and asymptomatic spread. So there's never going to be no risk going into a certain space, but it's pretty low risk right now, and everybody's doing a really good job of mitigating the risks as much as possible.
Here is another. I'm going to read this verbatim as well. I've heard recently a comment along the lines of, remember when you are looking for help and compassion, that most people have depleted their reserves and have none to give. Do you have recommendations or advice about the collective nature of this? Typically in a family or personal network, when one member is struggling, others around that person have the ability to care and comfort, but that seems less so now.
I would say that there's definitely a degree of truth to that. I think we're all feeling a bit tapped out emotionally, cognitively, with the added challenges and burdens that come with the situations that we find ourselves in. I guess I would just caution. This relates to what I was talking about earlier in terms of the all or nothing thinking. This idea that I have none, or nothing to give, sounds a little absolute to me. And so I think how you gauge that is really important. And if we're thinking about, kind of a collective, whether that's a family or a circle of friends or so on, being sensitive to the fact that other people might be struggling, and in some cases they might be dealing with bigger things than you are. I think that's a really good thing to have in your awareness. And you can ask, you can find out, inquire about the other person's capacity to assist you right now. And if they're saying, I'm really struggling right now too, then it's a good idea to seek support elsewhere. But I guess I would just caution the person who posed the question to be careful about assuming kind of as a default that we're all just tapped out, nobody has anything to give. That feels a little bit like that sort of pessimistic thinking that I think we're all somewhat prone to, at this time. And there are a couple other kind of layers of this right now because we're in winter, and I think that there's a good news, bad news part of this. For Minnesotans, in some ways, we know how to be, indoors during these months, and we know we have a set of coping strategies because we're accustomed to this. But we had that brief relative reprieve for the warmer summer months where people could be able to get outside and visit with others socially distant. And I think that was really beneficial for a lot of us psychologically. And now we're kind of back into hunker down mode again. And so it's more challenging in certain respects. But I guess, yeah, my main thing would be just to, that it's okay to ask, and that there's value to being sensitive to someone maybe not having as much to give, but don't assume that as a default.
Before I ask the next question, I'm going to add a comment in about our discussion around reading. And this person says, I have started reading magazines, paper, get away from the screen and those short articles. So there's a bit of advice for all of us.
And delete all of your social media accounts.
Yeah. Hussein mentioned access to healthcare. Would he be able to go into the pros and cons of telehealth for those seeking mental health services?
Yeah, I really appreciate that question. I would have to say pre-pandemic that I was a real skeptic about telehealth, and similar to what Jody was saying, I'm really looking forward to being able to sit down face to face with my counseling clients again. I really miss a lot of the aspects of just being in the office. That being said, I've been pleasantly surprised at how well counseling has translated, and in some cases have received feedback from students that they actually prefer the modality. And there are students, I'm thinking about our commuter students, students in some cases if they have a mobility concern, especially during the winter time, the ability to pop in instantaneously to a session and then go back to whatever it is they were doing without concern about how am I going to get there or how much of my day is going to be eaten up by being in transit back and forth has actually been really a game changer for some folks. So I guess I would say that I'm a proponent of telehealth and of teletherapy in particular. In my case, I think that there's a lot of potential value, to receiving care, in this format. And I still, don't want to have that be exclusively what I do. I think that there's some unique features and benefits of being able to, be in person. But this kind of goes back to this question of, are there things that we are discovering in the course of this pandemic that are, kind of silver linings or things that we may actually want to retain, afterwards. And I think there's sort of a deeper, I guess, almost signpost to that, and I'm prone to this too, this idea that my life is on pause right now, and it will resume again once everybody's vaccinated and we can all go back to quote unquote normal. I guess I would, I'm doing this with myself, and I would encourage other people to be careful about like deferring, kind of your enjoyment of life until whenever that point is, summer, late fall, whenever it happens. That there's importance to, for many reasons, of like being in the now and being present, even as imperfect or frustrating or as scary as it might be at times to be in this present moment. That we do ourselves a disservice and the people around us a disservice if we are just looking to live for the future.
As you look at the last months, in your opinions, how can interior environments be set up more conducive to healing? This person is a state certified interior designer. and looking at what is about getting in touch with nature and techniques that have been used with color or textures in multiple settings. My concern goes to workplace and the stressors of work and having to deal with mind. Is there any therapy that could be used in the workplace or any common thread?
This, in some ways, we're maybe coming full circle to where we started, and just the reality that many of us are spending a lot more time in indoor spaces these days. Again, my previous disclaimer: this is really pretty far outside of my area of expertise, but I think that there are potentially some real considerable benefits to thinking about how your space is organized, how you feel within the space, thinking in terms of feng shui, and do you find your space to be conducive to the things that you need it to be, whether that's to be able to concentrate. If your space is cluttered and chaotic, it may be much more difficult. And I think that there are people far more knowledgeable than me, who could give you ideas about how to create a space that will be sort of conducive to calm, to serenity, and so on. I think there's been a huge movement towards, kind of bringing elements of nature indoors into our spaces. And, I'm very much a proponent of that. I find that within my own home that I really like earth tones, or bringing elements of the natural world into my indoor space. But I would, I guess, caution that we can't expect that to serve as a substitute for outdoor spaces. And in fact, there's a lot of really compelling information research that suggests that being out in nature confers a number of significant benefits for our mood and for our psychological well-being, even relatively short periods of time of being out in nature. And some of it is also in the how of your being out in nature, that if you are really paying attention, to the subtle details. I know where I live within walking distance of a small lake, and walking with my dog around that lake, I have opportunities to notice seasonal changes in terms of what species of birds are active, what the muskrats are up to on the lake, those sorts of things, ways in which the foliage changes with time, and that if I am really paying attention to that, there is this opportunity to really be in the flow of it and to sort of be almost lost in it, to the extent that some of the things that I might be ruminating about or worrying about, work related or otherwise, tend to kind of be out of mind for a period of time. So it is really restorative. It's a rejuvenating experience for me. And so I guess I would say, well, while there are all those potential benefits of thinking about how you structure your interior space, don't forget the real significant benefits of getting out into nature, not just trying to import nature into your home.
We have about 5 minutes left, and so I think I'll ask you one last question. But before I ask that last question, do you have any journals or organizations? Jody, actually, you already mentioned CIDRAP at the University of Minnesota. Are there any other publications or anything like that that you folks turn to on a regular basis that you would recommend others do as well as we march forward in the next few months?
I'm assuming this is specifically about COVID.
Yeah.
Yeah,
or
I
maybe
suppose.
wellness in general.
Yeah, as far as like the medical information or the information about the virus, I really do. My starting point really is CIDRAP for the most part. I've found that the magazine The Atlantic has many very insightful commentaries on everything, COVID related, whether it's mental health or the virus or the vaccine, or so that's another one that I keep going back to on a relatively on a relative basis. And then other than that, I've really kind of tried to push out some of the noise, if you will. I try to stick to a couple of well-respected things, and then if something's referenced within that, I might go search it out. But I for the most part, those are the two that I really stick to with regard to like COVID. related information.
All right, I'm going to ask one last question, and it's a big one. It's a big one to close with. In light of if you can work at home, you should. What about students going to school? If they are able to be home for school, should they be home?
That's a very controversial question. I'm not really, like, I don't know that we know the answers to that yet. We do know that, like at Hamline, for example, if we look at our numbers and if we look at our case numbers and contact tracing and all of that, the little clusters that we had over the fall or for the last year really were not tied to the classroom, provided the mitigation efforts were all set up. And the same is really true for, K through 12 schools. We haven't seen a whole lot of transmission in that setting because it's more controllable than, say, households or parties or congregate living or those kinds of places. You can keep your distance well from people. And we know that children don't have tend to have as severe of a course when they do contract COVID. The controversy comes in about the faculty and the teachers and the staff. Are the students being vectors even if they're not getting sick? Are they the ones spreading it around? And there's conflicting opinions on whether or not that's the case. So again, I'm a proponent big time of working from home if you can, but I also understand that particularly with school, there are other public health considerations when it comes to keeping particularly small children at home for months and potentially years and not having any social interaction. And if it's a place where we can lower the risk as much as possible, and we can see from past data that it has been relatively low risk in that space, I think that it's an okay thing to consider opening schools to a certain extent. But I do think that individuals should be given the choice, to evaluate their own risk tolerance and not go to school if they don't want to. So I don't think that people should be forced to have it one way or the other, which is a really hard task, a really hard problem to put on institutes of education, both in higher ed and K through 12.
And though we didn't get to it this time, I mean, something in what you just said, Jody, that I think is a piece that is also important to consider in terms of self-compassion, I guess, that having to make these decisions repeatedly and to kind of recalibrate what is the level of risk here. I know, for myself, of having a college age student myself coming home for the holidays, and thinking about, what is the degree of, risk benefit, having to do these analyses repeatedly and to revise them based on some change in the situation or some new piece of information is really exhausting. And the cognitive load that's involved in that is, I think, part of why many of us feel we don't have as much to give right now. And so while I don't have a simple solution to what to do with that, I think this is a place where some self-compassion and recognizing, yes, you probably aren't going to be as productive as you normally are. You aren't probably going to have the level of motivation that you typically do. That some of the goals that seemed important to you in the past might not seem as important right now. I think that's part of what explains that, is that we're using a lot of brain energy right now to do these calculations. And so in places where you can, or you have the option to just keep it simple and just stay home, that's another potential benefit of just stay home. But recognizing that in some cases, the mental health benefits or some of the other benefits may offset that or be a mitigating factor is part of what has to be factored into the equation too.
Thank you. I've heard a few people comment, and I agree that one of the many things that I think will be really interesting when we're at a stage where this is studied in a holistic way is the effect on decision making and executive function, and how COVID has had an impact on that. So, well, that brings us to the end of our time. Jody, Hussein, thank you so much. It's such a pleasure to be able to work with you on these sorts of things and sort of bring your voice to a bigger community, and all of those who were able to join us today. Of course, we appreciate you being part of the Hamline community and choosing to spend your time with us. Nobody has a lot of extra time despite our changes in routine, so we certainly appreciate you being with us for this bit of time now. I will mention two other things. One, on a lighter note than what we talked about today, frankly, there will be another Hamline trivia session hosted by the Alumni Relations Office on February 12th. This one will be on campus landmarks. As always, it promises to be an exciting time. So watch for information there. And then we're working on more Leo lectures for the spring. Next up, under development now, we're going to have our colleagues from the Career Development Center come back, and on February 26th, we'll be doing a session on networking and some basics and tips and tricks and advice, but also networking as a tool to revitalize your professional energy, which goes maybe a little bit to what we talked about today and how to accomplish those things in a more virtual environment. So watch for more information about that. Thanks again to everybody, and that's it.